Hi everyone, in this video we'll be discussing another small topic, that is anti-helminthic drugs. So when we think of helminths, what comes to our mind is the Taenia solium, Taenia saginata. Then we have the roundworm, hookworm, pinworm, dark tapeworm. Then the flukes, liver fluke, lung fluke, all those things. So we have certain drugs to manage them. In anti-helminthics, mainly remember it is the drug of choice which is commonly asked in exams. So they will give the infection and then the drug of choice for that. So we have made a list here. So helminths, and we know that helminths, cystodes, nematodes, and trematodes. Now, what is the treatment aspect for the cystode, that is Taenia solium, Taenia saginata, fish tapeworm, and Echinana? For all these three, the best drug of choice is praziquantal. Its name is praziquantal, and where to use it? Taenia solium, Taenia saginata, fish tapeworm, and Echinana. Now, in the management of neurocysticercosis, in the management of hydrated disease, now what is better than praziquantal is albendazole. So, albendazole is the better option for managing neurocysticercosis and hydrated disease that is seen with the dog tapeworm. So, you can read like this: for all cystodes, the drug of choice is praziquantal, except neurocysticercosis and hydrated disease, the drug of choice is albendazole. Now, moving on to the nematodes. For all the nematodes, you take the example of Ascariasis, lumbricardis, Ankylostoma duodenale, Necator americanus, pinworm, Trichinella spiraliasis, Trichinella spiralis. For all these, for all the nematodes, usually the drug of choice is albendazole. The drug of choice is albendazole. But for filariasis and loa, the drug of choice is diethyl carbamazine. Diethyl carbamazine. In short, we write it as DEC. Now, is there any condition where we use DEC? Yes, it is also used in one more condition. Any guesses? Yes, it is also used in tropical eosinophilia. Tropical eosinophilia. Now, coming on to the management of strongyloidosis and onchocerciasis. Onchocerciasis is nothing but the river blindness. So, the best drug for managing that is a drug called ivermectin. Now, ivermectin is also used for one more condition, and what is that? Scabies. So, scabies, there is only one oral drug available, that is ivermectin. All the drugs for scabies are topical preparation, only oral drug is ivermectin. Now, cutaneous larva migrans, the drug of choice is either you can give albendazole. If that is not available, another option is ivermectin. Now, visceral larva migrans, the best drug is albendazole. Albendazole is the best treatment. Now, I can simplify this. Remember, for all nematode, the drug of choice is albendazole. Everywhere albendazole, but there is exception where in filariasis, loa loa, it is DEC. Strongyloidosis and onchocerciasis, it is ivermectin. And migraines and all, again, it is albendazole only. Exception is where cutaneous larva migraines, you can give albendazole as well as ivermectin. Coming to the flukes, trema means leaf, they are like flat. For all the flukes, you take the blood fluke, lung fluke, bladder fluke. For everything, then drug of choice is praziquantal. The drug of choice is praziquantal, except which fluke? Liver fluke. What is the other name for liver fluke? It is also called as fasciola hepatica. What is the drug of choice for that? The name is called triclabendazole. The name is triclabendazole. Many times filariasis may occur and we may require mass chemoprophylaxis. So what is the best drug for that? For them, we use albendazole. So along with albendazole, they add either ivermectin or DEC for mass chemoprophylaxis of filariasis. So please remember, this is the chart, and most of the times they will ask you the organism, they will ask you the treatment of choice. Recently they had asked H. nana, what's the drug of choice that had come, and also they had asked the visceral migraines, what is the drug of choice, strongyloidosis, what is the drug of choice. So if you know this chart, it's easy to answer these questions. So that is about anti-helminthic drugs. Remember, most importantly, what we need to understand is the organism and the drug of choice for that. So for in-depth understanding of anti-helminthic drugs, we are extending the video. For example, you want to understand about the best drug, albendazole. One of the best drug what we prescribe to the patient, an anti-helminthic drug, albendazole. Let us understand this pharmacology. So the first drug what we are going to deal is albendazole. Now albendazole, what is the mechanism of action? It has two important mechanisms of action proposed. Number one, it inhibits the glucose uptake in the helminth. It inhibits the glucose uptake in the helminth. And number two, it inhibits the microtubules of the parasites. Now, what is the problem here? Because of the microtubules only, they are hooking and adhering to the intestine, and also they require energy. If you block that glucose, if you block the microtubule, they will leave that hooking and they will be going out in the toilet, that is in the feces. So when that is done, the helminths are expelled out. They are expelled out, and that is the mechanism of albendazole. Main mechanism is to inhibit microtubules. Second is to inhibit glucose uptake. So this is how the helminths are expelled out. Now, if I want to understand the pharmacokinetics, this albendazole is converted into one more active one, that is called albendazole sulfoxide. It is called as albendazole sulfoxide. Now, the advantage of this active one is it has high VD and it has very good penetration into the cyst. So that's why albendazole is preferred in managing two important conditions. What are those? Neurocysticercosis, and one more important thing is hydatid disease. Hydatid disease that is caused by dog tapeworm. Because of this, it can have very good penetration. You may ask a question, sir, why neurocysticercosis albendazole is the best drug, not praziquantel? So what is the reason? When you are managing the neurocysticercosis, now what is the better drug? Albendazole is better than praziquantel. There are certain reasons for that. What are the reasons? The reasons are, now when you prescribe to the patient, cost has to be considered. Cost is less and efficacy is more. And the duration of treatment is lesser in albendazole. Praziquantel you have to give for long period, so duration is lesser. Duration of therapy is short compared to praziquantel. That is an additional point. Then another important is penetration into the cyst is good. Penetration to the cyst is good. And when you add steroids increase the effect of albendazole. So this is the advantages why albendazole is the drug of choice for neurocysticercosis. Sir, okay sir, neurocysticercosis is nothing but there are cysts in the brain. But when we use anti-helminthic, the cyst will rupture, larvae will come out and they start inflammation. When there is brain inflammation, patient will have seizure, convulsions. So how to avoid that? That's the reason before giving anti-helminthics, before giving albendazole, you have to start a patient on anti-seizure medications. So anti-seizure medication should be given before antihelminthics. You have to give anti-seizure medication. Anything else we have to add? Come on, come on. Who will suppress the inflammation? Steroids. So that can be used. So this is a question asked recently. Before giving albendazole, what should be added? Yeah. So give anti-seizure medications and steroids and then start. Now another important, there is a cysticercosis called ocular cysticercosis. So should we treat this? Should we treat with these drugs? No, they are not treated with drugs. Sir, why not? Why not are we giving drugs in ocular cysticercosis? The problem is the cyst where release the larvae, inflammation occurs, patient may become blindness. So blindness may occur. So that's the reason why we don't give drugs in ocular cysticercosis, because the risk of blindness is there. So that is about the albendazole pharmacokinetics and mechanism of action. Now, can we give albendazole for a newborn? No. It is contraindicated if the child is less than 1 year. Now, we know that we use it for deworming preparation. Less than 1 year child, it is contraindicated. So, if you are planning for deworming, so it is one of the drug involved in National Deworming Program. And when we use albendazole, 1 to 2 year old, the dosage will be 200 milligram. If it is more than 2 years, the dosage will be 400 milligram. Now you may ask a question, sir, why it is avoided in less than 1 year? There is always a risk of hepatotoxicity with this drug. So we don't want to take the risk, and it is better to use it more than 1 to 2 years, and the dose is also 200 milligram. So that is about the story of albendazole. There are other drugs which we also use in therapy. Let me tell you the drug's name. The name is called pyrantel. It is called pyrantel palmate. Now, what is the mechanism of action of this? This stimulates. What does it stimulate? This drug stimulates nicotinic cholinergic receptor, nicotinic cholinergic receptors in the worm. Now what happens? That will lead to spastic paralysis. Now obviously when there is spastic paralysis, the worms cannot hold on and they are expelled out. The drug name is called pyrantel palmate. It stimulates repeatedly nicotinic cholinergic receptor and there is spastic paralysis. Moving on to the third drug. The third drug is called piperazine. Piperazine. Now the piperazine is a GABA agonist. So GABA agonist. So usually if you think of GABA, it's an inhibitory noun. Now it will open the chloride channels. It will open the chloride channel. What happens if the chloride channels are opened? Obviously there will be cell hyperpolarized. So cells are hyperpolarized in the helminth. Now what happens? That will lead to obviously the flaccid paralysis. That will lead to flaccid paralysis, and the drug name is piperazine. The name of the drug is piperazine. It's a GABA agonist. It opens the chloride channel. It is hyperpolarized and causes flaccid paralysis. The name is piperazine. So once we know about piperazine, the next one what we are going to understand is a drug by the name levamisole. The name is levamisole, and you all know it is an antihelminthic drug. So the mechanism is it stimulates ganglia of worms. There are ganglions in the worms. The ganglia are stimulated. So what happens? This will lead to tonic paralysis. So if you observe their mechanisms, everywhere the paralysis occurs, so they lose the grip and leave the intestine. Now levamisole has a specialty. It is an immunomodulator, and it is used in a cancer. and it is used in a cancer called colorectal cancer. Now, it is shown to increase the effect of the anti-cancer drug 5-fluorouracil. So, along with that, levamisole, we add the 5-fluorouracil. So, this is the point. Now, the fifth drug, it is the DEC. I told you the full form of DEC is diethyl carbamazine. Now, what is the mechanism of action? Now, when the microfilaria are sitting inside the limbs, our immunity is not able to kill them because they have that protection from immunity. What happens when we give DEC? The mechanism proposed is they alter the microfilarial membrane. Microfilarial membranes. Now, when they alter this membrane, then the immunity will mount a response on them. There is mounting of immune response, and that will kill the filaria. So we know that DEC is the drug of choice for two conditions. What is that? Filariasis, and one more is the lova. And also we use it in a condition called tropical eosinophilia. These are the uses of DEC. Now, another important drug, it is called ivermectin. Now, ivermectin was also tried during COVID-19, but not so much effective. The mechanism of action is it stimulates a special channel called glutamate-gated chloride channels. Glutamate-gated chloride channels. Particularly, it is effective in the nematodes. Mainly, the effect is seen with nematodes, not with others, and that will lead to tonic paralysis. And I told you, this is the drug of choice for two important conditions, strongyloidosis as well as onchocerciasis. But one important thing happens when you are managing a patient of onchocerciasis. So it is also called as river blindness. So in this, we have two therapies we can use. Either we can use ivermectin or DEC, but the drug of choice is ivermectin. So when we start the drugs, many times what happens, there is a reaction that can happen, and that is called Mazotti reaction. It is called as Mazotti reaction. Sir, what is that reaction? What we see here, usually in that reaction, we see the fever, patient develops rash, and lymph node enlargement, that is called lymphadenopathy. Sir, should we stop the drug if the patient develops this? Obviously, it's because of the drug. First thing you have to do is stop the drug. Sir, what to do? To avoid this, you have to add steroids. So give steroids, give antihistamines. So this is how we manage the Mazotti reaction. Stop it. So the risk of Mazotti reaction is more with DEC compared to ivermectin. That's why ivermectin is the drug of choice for onchocerciasis, not DEC, because the risk is more with DEC Mazotti reaction. Right. So we are done with the ivermectin. The next drug, what we have come across repeatedly, the name is called praziquantel. So I told you praziquantel is the drug of choice for most of the cestodes and also for flukes. The mechanism of action, it increases calcium influx into the worm, that is helminth, and that will lead to spastic paralysis. That is the mechanism proposed. Then we have a drug called niclosamide. The name is niclosamide. What does it do? It inhibits PFOR. So what is PFOR? It is nothing but it is called pyruvate ferredoxin reductase. So PFOR stands for pyruvate ferredoxin reductase. Why it is required? Now this is required for electron transport chain. If I inhibit this, there is inhibition of electron transport chain. Now if you inhibit that chain, the energy process is hampered and the helminth is expelled out. So that is the mechanism of action of niclosamide, which inhibits the PFOR. So this is the point. So guys, in this slide, I discussed what are the some important points about and what are the important mechanisms you have to keep in your mind when you study these things. Okay, so the drugs are niclosamide, praziquantel, ivermectin, DEC, then levamisole, piperazine, parenteral, palmoate, then the major drug albendazole. So another drug which is similar to albendazole is mebendazole. So remember, these drugs end with bendazoles, and don't confuse with conazole, which is an antifungal drug. Many times you have that confusion, right? So summarizing the things, what we discussed is anti-helminthic therapy. Now, what is the drug which you have to mainly concentrate on? Albendazole, then you have to concentrate on praziquantel, and then DEC ivermectin. I'll summarize the things. All the cestodes, the drug of choice is praziquantel, except neurocysticercosis and Hyde disease, it is albendazole. For all nematodes, drug of choice is albendazole. Exception is the loa filariasis, it is DEC. Strangulidosis, onchocerciasis, ivermectin. Any migraines, albendazole. Another alternative for cutaneous larval migraines is ivermectin. Then flukes, it is praziquantel except liver fluke. The name is, the drug of choice for liver fluke is triclavendazole. That's it. That is about anti-helminthic drug. Thank you all.